Hello there. Could you just confirm your name for me? That's perfect. And your date of birth, please. Okay. You make yourself comfortable there. I'm Dr. Sarah. Pleased to meet you. Now I can see that you're here today for me to check out your ears and your nose. Yeah? Okay. So let me just pop some gloves on and we'll have a little chat about what's been going on. How long have you been having problems? Right, okay. Okay. Let me just check here. Have you been having any nosebleeds? No, okay. So it's a soreness up your nose, yeah? Okay. And ear pain? Okay. Your ears feel itchy? Alright. Okay. Nasal stuffiness? Yeah? Okay. And nasal discharge? Okay. So you have some clear discharge but sometimes discoloured? Okay, yeah. Sneezing? Okay. Have you got any known allergies? Right, okay, generally hay fever, okay. And dust mites, that's a common one. Okay. Have you treated your nose and ears with any other medications recently? Not for a while, that's good, because I'd rather see them in their worst state than when they've been treated by something. Yeah, some people sometimes come when they've put decongestant up the nose, or they've got special drops in their ears, and it's not very helpful if it's calming down the thing that I'm trying to investigate. Although I will need to use a decongestant on you today. Yeah. Okay. Have you had any allergies to decongestants like pseudoephedrine? No, okay. It's not pseudoephedrine that I'm going to use today, it's a different type. But sometimes we can ask patients to take a pseudoephedrine, but I won't be doing that today unless I really have to. Okay. Some people can get very bad palpitations, dizziness, agitation with pseudoephedrine. It doesn't suit a lot of people. Okay. So I'd like to take your temperature, if that's okay. Alright. I'm just going to pop the thermometer into your ear. Okay, there we go. I'll use your left ear. Just going to pop that in. Okay, you'll hear a few little peeps. Just relax there. Alright. Okay. Well, the temperature is absolutely fine, so that's good. You've had no recent colds or anything like that? Okay. Your temperature is 36.9, so that's wonderful. Okay, let me just have a little feel of your lymph nodes, if I may. Okay. Just down the neck. Just feeling for anything unusual. Little lumps, spongy lumps, hard lumps. Any pain or tenderness when I do that. Okay. Just behind your head, I'll come in a little bit closer. just across your collarbone. Okay, that seems fine. Let me just check just under your jaw. Okay. Do you have any pain when I press just around your face? Okay. Could you just open and close your mouth for me? Okay, that's good. Okay. Could you just open your mouth for me? I'm just going to shine a light and have a little look. Okay, perfect. Okay, could you just say "ah" for me? Alright, that's fine. Okay. Right, let's take a look down those ears, shall we? I'm just going to be using this otoscope. Right. I'll gently insert it into your ear. Okay, and have a little look around. Alright, just stay nice and still for me. I just want to see if there's anything visual in your ears that I can see would be causing a problem. Okay, I'm just going to pull up and back very gently on your ear and insert that there. Wonderful. Is that okay for you, my lovely? Okay. Okay, right. Now your ear canal looks a little bit red and agitated, which is something that we would see in allergies. Okay. The eardrum looks fine. I can see the light reflex there is normal and the structures behind the tympanic membrane are visible. Normal amount of earwax, so that's fine, no problems. It just looks a little bit red, which is what's causing that itching, I think. Okay. Alright. Let me just reposition slightly there. Okay. Alright. Just looking a little bit further up there. Okay. Let me just withdraw that now. You alright there? Good. Okay. I'll check this ear now. Okay, just going to pull up and back again on the ear. And insert the otoscope gently into your ear canal. There we go. Is that okay for you? Good. Again, we're looking a little bit red there. A little bit red. Eardrum looking normal, which is wonderful. Nothing unusual to visualise there. Just that redness again in the ear canal. Just reposition that a little bit. Okay. That's lovely. Just withdraw that now. Just withdraw that. There we go. Okay. So again, there's redness in both of your ears. Okay. I'm just going to have a little feel around the external ear now, if I may. Okay. So, just going to gently visualise the pinna of the ear down to the lobe, gently pressing. Just press, 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 press. Anything feel sore there, my lovely? No? Okay. behind the ear. Okay. Alright. And that still feels all comfortable there. I can't feel or see any lumps, bumps, scars. Beautiful. Okay. That all seems fine. And absolutely sure there was no pain there. Okay, that's great. Just that itchiness inside. Okay. Let's check this one for you then. Okay, just gently pressing around. Press on the pinner and down to the lobe. Gentle tapping there. Does that feel alright for you? Okay. Just little circular movements around the ear. Just looking behind. Looks fine, no lumps, bumps or swelling. Okay, so I'm just going to give each of your ears a little tug. I just want you to tell me if that feels uncomfortable. Okay. So I'm just going to tug down on this one. Okay, alright. Perfect. On this side. Tug, tug there. Alright. That's fine. That's fine. I wouldn't expect it to be painful because there didn't seem to be anything in the way of real infection in your ears, but it's always good to check. Yeah, okay. So now I'd just like to take a little look at your nose. I will look at your nose with an endoscope shortly. Okay, but I'll talk to you about that in a second. So I'm just going to push the tip of your nose up very gently, okay? Keep nice and still for me, my lovely, thank you. Push that up and just in with that otoscope there. Okay. I can see some redness. Right. Okay. And up this side. Okay. Okay, looks like there's a bit of redness. Okay. I just want to check your sense of smell very briefly, if that's okay. Good. Right. Let's just open this. Could you tell me what that smell is? Good sniff. Lavender, well done. That's perfect. And let's just try this one. Okay. Good sniff. Lemon, that's wonderful. Okay. So, I'll just let you sit there for a couple of moments and then I'll come back with the rest of my equipment and explain what I'm going to do next, if that's all right with you. I'll just write up a couple of notes. Yeah? Okay. Okay. You doing all right there? So what I'd like to do is do a nasal endoscopy, and that will involve me inserting this flexible tube into each nostril. There is a little camera in the end, and that will just show me on the screen over here what's going on up inside your nasal passages, okay? No, it's not going to hurt. I'm going to give you a decongestant and some local anaesthesia up your nose. It's very short acting, okay? And you'll feel fine. If anything is uncomfortable, obviously tell me, yeah? But this will enable me to get an absolutely perfect look to see what's going on, because the otoscope, you can only really see so much. With this, I'll be able to go further up, yeah? And I'll even be able to see just down the back of your throat as well. You okay with that? It's a procedure that's done in an outpatient clinic all the time. Yeah, as you can see, it's just nice and flexible, and it's not going to hurt you at all. Okay, that's great. So, what I'm going to do first is have a little spray with this. This is a decongestant, okay? It doesn't burn or sting. Alright, so just keep your head nice and still for me, and I'll just have a little spray. There we go. And up this side. How's that? Tickles a bit? Yeah, thank you. There. Just get that little eye pop there. Okay. Take some nice deep breaths for me now. Okay, nice deep breaths. Alright. That's perfect. Can you just occlude one nostril, breathe in deeply. Alright, and the other nostril, breathe in deeply. Okay, wonderful. Alright, so what I'm going to do now is apply some local anaesthetic into each nostril. I'll be doing this by putting the solution onto these cotton buds, okay? And it will feel very strange as they go numb, and they will go numb within seconds, alright? But I'm not going to use the spray, because the spray can run down the back of the throat and can numb the throat, which isn't so pleasant, and we don't need to be numbing the throat today. Alright. Okay. So let's just pop some of the solution on there. Okay. Alright. I'm just going to lift the tip of your nose up and come underneath and just insert this and rub it round, okay? Alright, there we go. Right, there we go. Tickles for a moment, but it'll soon be numb. Okay, wonderful. Let's do the other nostril now. Sure that's on properly. Okay, do this side. There we go. That's right up there. There we go. Should be feeling all numb soon. Okay. Just get the nose a little massage. Okay, just around the nostrils there. Right, just make sure the computer is all set up there. Right. Okay, and the images will be on this screen over here. Okay. To spray a little bit of lubricating solution on the ends. Okay. Just so it goes up easier. Alright then. We're good to go. So are you ready? Okay, if you feel anything uncomfortable you must tell me. Alright. So I'm going to start with your right nostril. Keep your head very, very still. Just tilt back very slightly. There we go. Okay, just coming in with the endoscope now. Okay. There we go. Well done. Alright. Okay, so I can see that the nasal linings are inflamed. Alright. Okay. Yeah, I can see that they are rather red. The turbinates look a little bit swollen. Slightly deviated septum, which just means your nose is slightly bent more one way, which can cause problems with breathing, particularly if you've got a cold or something. One side will block more. Okay, so I'm just going to withdraw a little bit. Alright, you okay there, my lovely? Perfect. And just going in just a little bit deeper now. Okay, just going to pop that endoscope a little bit further up your nose. There we go, that's wonderful. Let's have a look up there. Just going a little bit further up. Okay. Right. Okay, does that feel alright for you? Okay. Yeah, you've got really inflamed sinuses, literally. Nasal lining is really angry. A little bit further, my lovely. There we go. Well done. Doing great. Okay. Yeah. I can see you've got what we call post-nasal drip, which is where mucus drips down the back into the throat. You may find you get tickly sore throats, or you have to cough a lot, clear your throat. Yeah. Okay. Right, I'm going to gently withdraw that now. Alright, keep nice and still for me. There we go. How is that? Okay, right. Spray a little bit more on here. Make sure it goes up the nostril. Nice and easy. Okay, so let's take a look at that left nostril now. Okay, you ready? Perfect. Just inserting that now. Okay, let's just take a look. Again, very irritated, swollen, red nasal lining there. You can see there's quite a lot of mucus production. Okay, you're doing really well, my lovely. I know it's a strange thing to have done. Okay, just going to withdraw slightly and then go in a little bit deeper. Okay, a little bit more. Okay, turbinates look a little bit angry. We'll obviously we've noted the septum before being deviated. Okay, just up a little bit more now. Alright, okay. Is that comfortable? Good. And again, seeing the post-nasal drip in the back of the throat there. Okay. Well, I think I've seen all I need to see there for now. So let me just gently withdraw this now. Okay, there we go. That's the endoscope all out. Right. Let's give your nose a little bit of a massage there. Okay, are you feeling okay? No dizziness? Okay. Nothing's bleeding, don't worry, it hasn't made anything bleed. Okay, it just will feel very strange. But the local anaesthesia will wear off in about 15 minutes. Okay? Alright. So let me just write a couple of notes down there. And you just relax. That's perfect. So, let's just see how your sense of smell is now again. Just make sure everything's still fine. Okay. Yep, that's the lavender. Perfect. Okay. That's wonderful. Everything is looking fine. Okay, so based on my findings today, I think what you're suffering from is an allergic reaction, okay? It could be a long-term allergic reaction, okay? Or something very acute. Now, if it's chronic, you will be getting these symptoms all the time, okay? Acute allergies can turn into chronic allergies, okay? Our bodies change all the time and we can become allergic to things that we weren't allergic to before. Alright. Now I know you've got your hay fever allergy there and you've also got your dust mite allergy, which I said were very, very common. Okay, but if you can't think of any new allergens that you've been in contact with specifically, I would like to send you forward for some allergy testing, okay? It may be something you're in contact with all the time and you don't think about it. Alright. Because I want to just make sure that we get to the bottom of it. Alright, so I'll just make some notes there. I know the allergy testing team are quite busy at the moment, but I should be able to get you seen within a couple of weeks. Okay, so I'm just going to do that there. Alright. Now, I'm going to prescribe you an antihistamine as well. Okay, now you can take that in the meantime. Once you get your appointment, I want you to stop taking your antihistamine 4 days before. Okay, this will give your body a chance to pick up on the allergen again and react to it. Okay, I just want to give you a little short-term relief until we get you seen by the allergy testing team. Alright. You can also use a decongestant if you like, but again, please withdraw usage of that. Alright. Would you like me to prescribe one of those as well? No, okay, you're happy with that. Alright. So, I'll get the prescription typed up in a second and sent right over to reception, and they will sort you out with that, and you can collect that from our on-site pharmacy here at the clinic. Yeah, but in the meantime, take good care of yourself. Yeah, and I'll see you again very, very soon. Once the allergy team have seen you, they will refer you back to me to have a further discussion about things. Okay, enjoy the rest of your day and pick up your script on the way out. Alright, take care. Bye bye.